This is part 2 of hallucinogens, and we're going to start with MDMA, which is better known as ecstasy. It's created while looking for an amphetamine. So it was created by a chemist looking to create a stimulant like drug to suppress appetite. It's actually meant to curb appetite. So it's similar to MDA, which we talked about at the end of part 1, but it's shorter acting, lasting about 4 hours. So it impacts many neurotransmitters, so including serotonin, dopamine, norepinephrine, and it increases neurotransmitter activity, so it's similar to an amphetamine as well. So it has hallucinogenic and euphoric feeling, the warm feeling, emotionally grounded feeling, self-acceptance, reduction of fear, perception of reality is altered, sense of pleasure, emotional insight, and enhanced self-esteem. So it typically does not impact your cognitive functioning though. So there is a link here which I'd like you to take a look at. It's from the CCSA regarding MDMA specifically. So MDMA continued. So it's been researched as a treatment for PTSD. So using it as actual treatment in combination with psychotherapy. So there are restrictions of the clinical use because there's some inconsistencies with what people are finding when using it. So there are, of course, unfortunately, some side effects using it. But it also is a street drug and it's associated with raves. So there is a journal article I'd like you to search for. So it's in the Fleming Library. I want you to search for MDMA and PTSD treatment. PTSD from novel pathophysiology to innovative therapeutics, and this is written by Ben Sessa. It is an article, so it's an actual journal article. I'd like you to look through, give some information about the types of symptoms of PTSD and how MDMA seems to help counteract those. So you can pause now and take a look for that. So MDMA is usually an oral administration, so by mouth. The effects are felt within 30 minutes and last about an hour, so a short effect. Usually impairs judgment, there's some confusion, false sense of affection, can cause depression, anxiety, increase impulsivity, and paranoia. So some other effects: insomnia, lethargy, kidney damage, hypertension, weight loss, anorexia, meaning not eating or not wanting to eat, anxiety, panic attacks, depression, aggression, altering brain chemistry, increase in body temperature. So when somebody's at a rave and take MDMA, it's very dangerous. They can overheat, so needing to cool down, lots of water, get out of the hot climate. Dehydration, again, same reasons. Memory loss, seizures, long-term problems with emotions, memory, sleep, pain, and sometimes having flashbacks. And these inconsistencies in the outcomes, as with all hallucinogenics, effects are unpredictable. Some more about MDMA. So it is it's neurotoxic that can destroy serotonin-producing neurons. So it's destroying the actual neurotransmitters that are creating serotonin, playing a role in the regulation of aggression, mood, sexual activity, sleep, and pain sensitivity. So if you're destroying those neurons, then you won't have the ability to regulate those things. So ongoing use of MDMA can cause long-lasting brain damage related to thought and memory. So death can occur. The pressure the drug can have on the heart and the respiratory system, but there is no technical lethal dose. So the drug itself isn't going to kill you. It's the impact on your heart and the respiratory system. Usually cause hyperthermia, so body overheating and dehydration. The persons that are most vulnerable to this are people with pre-existing heart conditions, epilepsy, diabetes, and mental health conditions. So Molly, you might have heard the term Molly. It's pure MDMA, but usually it's cut with bath salts, and this can cause significant adverse reactions. So nutmeg is a mescaline-like hallucinogen. So the active ingredient myristicin, it's related to that trimethyloxyamphetamine. For psychoactive effect, it's either eaten, grounded, powdered, and snorted. Feelings of depersonalization, so feeling out of your body or unreality. At low doses, there's a mild brief euphoria, lightheadedness, stimulation. At higher doses, rapid heartbeat, excessive thirst, agitation, anxiety, panic, vomiting, hallucinations. The effects begin slowly and last several hours, followed by excessive drowsiness, and then the recover extremely physically unpleasant hangover. So it's like the worst hangover you could ever have. So another mescaline-like hallucinogen is PMA. So it's nicknamed the death drug. It's more pronounced hallucinogenic and stimulant properties than MDMA has. So it's more toxic, meaning a person needs much less of the drug to get the effect and to have adverse reactions. It does not produce feelings of warmth and comfort associated with MDMA, and it can be fatal. PMA is usually marketed as MDMA, so people pretending it's MDMA, which leading people to believe that it's MDMA and then taking more than they should. And then they'd have a faster reaction to that dangerous drug. So another mescaline type is scopolamine, nicknamed the devil's breath. So it's extremely potent, and it blocks the neurotransmitter acetylcholine. It blocks the retention of new information and the ability of the user to pay attention to tasks, produce auditory and visual hallucinations, disorientation, euphoria, fatigue, motor incoordination. So it can be very dangerous, especially if somebody doesn't know they've been given it. So similar to like a Rohypnol, which is classified as a date rape drug, so it can cause the same types of issues along with that. So sedation at low doses, restlessness at higher doses, dreamless sleep, disorientation, confusion, memory disturbances, and dizziness. Can also cause excitement, restlessness, hallucination, delirium, especially if the person has severe pain. Higher doses, a lot of confusion, agitation, rambling speech, hallucinations, paranoia, delusions, disorientation. It can also aggravate seizures and psychosis for those people who are already prone to those. So if you already experience seizures or psychosis, it will make that much worse. Okay. So TMA, it's more potent than mescaline and usually taken orally or injected. After 2 hours, there's intense auditory and tactile sensations and mescaline-like hallucinations. The amount required to create an effect is very close related to toxic levels, so it's very dangerous. You don't always know how dangerous it will be. Lower doses, it's similar to mescaline, but higher doses is unprovoked anger and aggression, so it can be very unpredictable. So now we're moving into dissociative anesthetics. So specifically, we're looking at ketamine. So these, or for the first to start is ketamine. So these dissociative anesthetics possess depressant properties. So along with the hallucinogenic properties, they also have a depressant effect. So slowing of the central nervous system. So that would be similar to an alcohol. So ketamine is currently used for surgeries where the patient only needs to be unconscious for about 15 minutes, but more often used as an animal anesthetic, so like a cat sedative. So it's similar to PCP, but it's 10 times less potent. So at lower doses, a lot of delusions, mental confusion, hallucinations, psychosis-like states, violent dreams and flashbacks are pretty dangerous. Larger doses, something called a K-hole. So it's a feeling of a mind and body separation. So you're kind of floating outside of your body. Can lead to stupor, unconsciousness, feelings of confusion, loss of short-term memory. Can also experience a loss of motor control, so difficulty walking, standing, and talking, memory loss, numbness, decreased awareness of environment, sedation, disorientation. This is why it can be a very dangerous date rape drug as well. If somebody can't remember where they are, don't really know where they are, have a hard time walking, talking, standing, this could be very dangerous. And a lot of overdose potential when it's combined with alcohol, because ketamine possesses depressant properties, and mixing with alcohol, overdose is more likely. But research has shown that ketamine has some antidepressant abilities as well. And there's been some research being done on ketamine for its therapeutic uses for treating depression. So there is an article I'd like you to take a look at. The article's name is Ketamine as a Novel Treatment for Major Depressive Disorder and Bipolar Depression. It's by Lee Della Selva, Liu Liu and Himmelhock, 2014. So they could go to the Fleming Library site and search for that article and take a look through it, please. So PCP, phencyclidine, is another dissociative anesthetic. It was developed as a general anesthetic, so for surgery purposes in 1950s, but it produced convulsions, delirium, confusion, visual disorientation, hallucinations. In the 70s, it became an abused street drug. It was pretty easy to make, and it was inexpensive. This drug is very difficult to classify specifically because different doses cause different effects. So it's not related to LSD or mescaline because it causes hallucinations by blocking a subtype of glutamate. So the way it causes hallucinations is different. Because as we said in the beginning of this PowerPoint, it talks about how hallucinations are created and how they're classified. But it's similar to opioids because it blocks dopamine reuptake, but it also has stimulant properties. So PCP is a very difficult to classify drug. So at low doses, PCP causes euphoria, relaxation, sedation, perceptual distortions of time, space, and body, visual and auditory hallucinations, and feeling of dissociation, so being outside of your body. It impairs your attention, concentration, judgment, motor coordination, and speech. Your pupils are constricted, blurred vision, increased body temperature, and mild cardiac stimulation, so your heart rate increases. At higher doses, it's acute toxic psychosis, paranoia, confusion, disorientation, restlessness, hallucinations, anxiety, agitation, personal alienation, delusions, and bizarre and violent behavior. Also muscle spasms or absent reflexes, so not having any reflexes when you need them. Prevents feelings of pain from injuries. So again, you could get hurt quite easily if you're on PCP but can't feel pain. Irregular heart rate, very high body temperature, slowed breathing, and severe nausea and vomiting. At very high doses, can lead to seizures, coma, you could stop breathing and die. Also have a stroke, your kidneys could shut down, catatonic rigidity, accidental and violent death because you don't feel pain. Long-term effects, so there can be flashbacks, can cause anxiety, social isolation, severe depression, memory impairment, unpredictable violent behavior. So a tolerance can develop to this drug, but physical and psychological dependence is still unclear. So another dissociative anesthetic is Salvia divinorum. So this is a plant that's in the mint family and related to sage as an herb. It's used in Mexico for religious ceremonies. It's chewed leaves or drinking the juice. When it's inhaled, there's short-lived effect, but intense hallucinations that last about 30 minutes. So it's comparable to LSD, but the mechanism of action is different, so how it impacts the brain. So it's characterized as a positive effect, but some psychotic reactions have occurred. So the long-term effects, so if somebody uses it for a long period of time, it can impair their learning and memory. But there's no indication that there is an actual physical dependency on this drug, so no real withdrawal. The active ingredient is salvinorum A. It's the most potent natural hallucinogen. So it's unique because it activates the kappa opioid in the brain. It's a dopamine receptor partial agonist, but it has no action on the serotonin. So it's different in how it impacts the brain. So Salvia divinorum, so it's psychedelic-like changes in visual perception, mood, body sensations, emotional swings, feelings of detachment, modified perception of reality, decreased ability to interact with your surroundings, loss of consciousness, short-term memory loss, lack of physical coordination, slurred speech, and awkward sentence patterns. Could also experience ataxia, which is a lack of muscle coordination affecting speech, eye movements, swallowing, and walking. So it could be very dangerous. Depersonalization and unconsciousness, dizziness, nausea, decreased heart rate, chills, feelings of body warmth, and sweating. And lingering effect can be felt once a normal awareness of self returns. So once the most effect of the drug wears off, you can still have a lingering effect. So we're going to pause now and we'll come back for part 3.